All right, what's up, people? It's your boy Jason Muse, aka the Black Muse, and welcome to another episode of the Black Muse Podcast. I'm cranking these bad boys out, man. I'm generating this content on this mighty fine Saturday. Um, yeah, this next story I think is very interesting, and actually, the next two segments that I'm going to cover are going to entail some potential criticism against the right wing and the Republicans. Um, there have been somebody asked me recently, I can't remember who. Do you ever like are you ever critical of the right? It's like, yeah, all the time. So at least the next two segments will demonstrate that. This one maybe not as much because there's a lot of unanswered questions here, but there's definitely a lot of potential to criticize Republicans for sure. And I've been critical of those right of center generally with this topic. So I haven't talked about it in a while, but I'm going to talk about it now, and that is the subject of vaccines and the COVID pandemic and all of the controversy that is going on with that. So there's an interesting headline that no one's talking about, and I'm actually shocked that not more people are talking about it. I have a headline here from Left Leaning Slate, and the headline reads: A study finally shows just how much deadlier COVID has for Republicans. Dun, dun, dun. The proof is out. Let's take a look at it. Let's evaluate it and see what we can find or what we can conclude. But there has been a study published recently, or I don't know what the state is. I don't know if it's published. I'm going to show it to you in a second. It says working draft, so it seems like they're continuing to write it. But that study is cited in this article. I also have a right leaning article in terms of the Washington Examiner that I'm going to see what they say. But let's start with the left leaning one. So here's Slate, according to Ground News, left by. And suggest that rhetoric is to blame. So there's been a fairly reasonable or at least understandable contention by those left of center that the anti-vaccine rhetoric has been costing lives or contributing to the loss of life that happened under the COVID pandemic. And so the urge to want to lay the blame at the feet of the no good, very bad, evil Republicans at least has some support because of this dynamic. It tended to be, for the majority of the pandemic at least, it tended to be those right of center who had something to say about the vaccine, about how they weren't going to get it, about how it wasn't trustworthy, about how they didn't trust it, about how it stood to damage people, etc. And those left of center found that really, really upsetting for various different reasons, but I think probably the most justifiable reasons is the vaccine was supposed to be the thing that prevented death, or at least made it very, very unlikely. And so if you have a whole bunch of rhetoric whereby people are genuinely believing that the vaccine is not going to help them and they're not getting it for that reason, then you maximize the amount of people who are probably going to die. You also, it was argued, maximized the likelihood that the virus was going to spread, which means more deaths. And you also maximize the likelihood that the virus is going to mutate and then become more resilient to what we had in place, which were the vaccines in the first place. So no matter how you chop it up, according to this view, which I think was fairly reasonable given what we knew at the time about how the vaccine works and how it was transmitted, and we didn't know everything up front too. We this kind of developed over time. I think that there were missteps by people with a lot of great intentions. They're very well motivated. Um, but then in this kind of cultural milieu, especially given our kind of propensity as a country for being extremely socially and politically dysfunctional with our culture war bullshit and nonsense, um, you had some people who took the kind of reasonable doubt about the vaccine's efficacy, about the potential for the vaccines to harm people, given how fast it was developed, and given the kind of innovative mRNA technology that it entailed, and took it in a whole nother direction and developed a whole bunch of conspiracy theories that I think were motivated or rooted in a very healthy skepticism and distrust, at least at first. And they started making all kinds of accusations about how our people's DNA was getting programmed and shit, and how the government had some nefarious plot to track people by inserting and injecting things into their bodies to control the masses and all that kind of stuff. Now, I didn't really buy into most of those kind of claims. I think that those are extreme, and there's not really much uh, there's not really much to lend support to a lot of those kinds of accusations, allegations, whatever you want to call them. But I was able to, within the limitations of my understanding, as being a non-expert. I'm not an epidemiologist. I'm not a virologist. I do not fully understand how viruses work generally or how vaccines work generally. I do not understand mRNA technology pretty much at all, other than some YouTube videos that I saw, and that's not really understand. I mean, I think it helps the understanding at a basic level, but it's not expertise. And so there's a lot of opportunity for me to get things wrong. I think that I was able to keep a level head for the most part and acknowledge the rational base out of the, I think, reasonable doubt about the dangers of the vaccine, given the way they were developed, given how fast that they were developed, and given the really new state of the innovative mRNA technology, and also given evidence that we found pretty early on about the propensity for blood clots, particularly in African Americans, and also the impacts that have now been confirmed subsequently, that it's having on women's menstrual cycles. Those we had evidence to believe these things fairly early on, and those things have since been confirmed in terms of being actual dangers, however rare they may be. So people being hesitant in light of those things, to the extent that they knew about those risks, okay, made sense. There was also certain things that we knew before in terms of certain populations being more susceptible to being hospitalized or dying than other populations, people with comorbidities and people basically who are the elderly. But there are certain populations among whom death wasn't really as likely at all. And the statistics were very clear about that from early on. And so if you had people from those populations who were vaccine hesitant because they weren't willing to take the risk, that made more sense. But you had a whole bunch of people left of center who I think had a understandable impetus of compassion for wanting to maximize the amount of people or the percentage of the population that were vaccinated, who were really gung ho about it, to the point where they were saying a lot of nonsense or a lot of things that were like partially true but in order to kind of steamroll people and make people like shame people into getting vaccinated, like it was their moral fucking duty or some shit. So shit got out of hand, and there were a lot of pompous people who were totally willing to sign on to private institutions and organizations, basically punishing people at the behest of the government for not getting vaccinated, taking away people's jobs. You even had healthcare workers who wasn't really trying like for that shit. They understood from a healthcare lens some of the reasonable pushback and reasonable basis for doubt about vaccine policy. And so forcing even and they were I think a minority for sure. I think they were probably less than like 15 to 10% of the medical force tops, uh, were uh, were kind of fighting against the mandating of vaccines. Um, and they were in the best position, where a lot of them were in the best position to understand kind of the things that I touched on. So all of this kind of forms the background of COVID, and COVID was kind of a mess for a lot of different reasons. COVID policy became extremely partisan very, very early. I mean, even wearing masks became a culture war issue. So you have a study now that gives some credence or lends some credence to a contention that people left of center have had all along, which is that the no good, very bad, evil Republican types, who have a propensity to, become very conspiratorial in nature, and the Q people are a part of that faction. They were effectively killing people with their anti-vaccine rhetoric and would launch political stance in opposition to anything that was being recommended by the likes of Dr. Fauci and HHS, under particularly under Joe Biden. Um, and a lot of that stuff just seemed motivated by more just distrust than any kind of scientific facts. Although there were early on, when we didn't know a lot, some scientific bases to have some kind of reasonable doubt. But I don't think that there was ever any reasonable, rational justification for the anti-vaccine stance that a lot of people took. And also, part of what made it awkward was that the selectivity with which this anti-vax stance applied. People weren't anti-vax across the board. They were just anti these particular vaccines. Now, to be somewhat fair to steel man the position, a lot of people recognize that there was something special about these vaccines in that at least two of the three main ones that were being administered in the country made use of mRNA technology, which was novel and new. I don't know that there's ever been any vaccine prior to the COVID vaccines developed by Pfizer, um, and I want to say Moderna, use of that technology and were administered in such a wide scale, like ever in like global history, and in particular American history where I live. So there was a uniqueness factor that may have justified treating this differently from other vaccines, because it did leverage a new technology and that people had questions about that. And there was never, that I know of, any long-term studies about the long-term effects of the application of this technology to a vaccine of this kind. And so you had a lot of, I mean, in many ways, it is understandable to point out that a lot of people were guinea pigs, at least with respect to that domain. However, I think the data is pretty clear, the data that I've seen, and I'm not an expert, so maybe there's a possibility that I may be misinterpreting the data. But as far as I've seen, the data is very clear that the vaccine was effective in doing two primary things. It minimized the likelihood that that were vaccinated and boosted would die of the vaccine, and it minimized the likelihood that they will be hospitalized. Now, coming from a person who got vaccinated, Johnson and Johnson, mind you, which I guess was the least effective of the three according to the early studies, got the vaccine, was vaccinated, and still ended up being hospitalized. I had what they call a breakthrough case. So two things that I have to take into account if I'm going to be objective. One, I took what is argued and has been argued from the start to be the weakest or the least effective of the three main ones that were introduced to the United States. Two, I wasn't boosted, but it was because the booster wasn't invented yet, or wasn't even available yet at the time that I got sick after I had been vaccinated. Um, Three, I had a pre-existing condition, or I guess I wouldn't call it a comorbidity because I didn't die, but I had a pre-existing condition that was basically diabetic at the time. Um, my health was terrible. I was eating terrible, and I was not exercising, stuck in my house with everybody else, and I used that as an excuse because I was lazy. All of these things contributed, I think, to my the vac the I guess the COVID hitting me harder, and I ended up being hospitalized. I was in the ICU for 5 days, followed by 6 days in the PCU. I lost a lot of weight, which I've gained some of it back, which is a bad thing. I actually wanted to keep shit off. I lost a lot of weight and in an unhealthy way. And it did a number on my lungs. I could not believe I had to be on an oxygen tank for like a month and a half after I came home because my lungs were fucked up. Now, I didn't administer any long COVID symptoms. I think that the vaccine helped with that. My recovery, where I was able to go home in 11 days, I think was helped by the antibodies that were built up from the vaccine. I also got antibodies that were generated from actually being introduced to the virus. It's not clear whether I got the Delta virus or the Delta strain of the virus, but Delta became popular, or became kind of like the main dominant virus right when I got sick. So it's likely that I got the Delta strain, which is a stronger strain, etc. I don't know enough about this to evaluate this in any objective way. Um, there have been people who are vaccine hesitant, who I know in my life, who have suggested that actually what made me sick was the vaccine itself. Possible, I guess. Johnson and Johnson, the way that it works from my limited understanding is that it's a more traditional vaccine, so it's a weakened strain of the virus. So it may have been that made me sick. Conjunction with my very, very like terrible poor health might have generated the hospitalization I need. My body's ability to metabolize oxygen was my so much. The time that I went to the hospital, my blood oxygen level was fucking 40%. That's ridiculously low. That is so low that I was on the verge of what is called hypoxia. Hypoxia can cause organ failure, I think long-term brain damage, and it causes like your veins and capillaries and shit to constrict. I could have went into a coma, according to what my doctor told my father, and my father relayed this to me because my dad talked to doctor, while I was in the hospital. He came to visit me. So that's the information that I have. Again, non-expert. Some of the people who have doubts about the efficacy of the vaccine or about whether the vaccine made me sick, I'm not going to settle that debate. I just don't know enough, and it's not clear that the doctors were able to provide me any answers. I asked them questions to whatever extent I could even talk at the time, and a lot of the questions that I asked, they would have had to test for, and they just didn't test because it wasn't a part of the ICU care that they were providing me. So one of the questions that I had was, did I have the Delta strain? They probably could have tested for that by testing my blood in such and such a way. That's not a standard procedure for treating patients who come to you with COVID. So they didn't do that. All right. Now, all that to say that this study here gives some credence to the idea that the kind of stereotypical right-leaning stance has contributed in some non-trivial way to people. So here we go. For at least a year now, there has been strong but largely circumstantial evidence that right-wing anti-vaccine rhetoric was having deadly consequences in the United States. Despite early wide-scale access to COVID-19 vaccines, the U.S. has outstripped its peer countries when it comes to the all-important measure of mortality known as excess deaths. U.S. life expectancy has continued to drop dramatically due to the coronavirus, even as longevity measures have begun rebounding elsewhere. One seemingly obvious explanation for this grim piece of American exceptionalism is that Republicans, egged on by right-wing political and media elites, have been avoiding simple public health measures to protect them, like getting vaccinated and dying at elevated rates as a result. This problem wasn't exactly hard to pick up on just by paying attention to social media or reading the news, but the story to be borne out by more careful data analyses too. Some of the key clues. When it comes to the public's belief about the pandemic, such as whether there should be more or fewer COVID restrictions, the gap between left and right-leaning voters has been much higher in the U.S. than elsewhere. COVID cases and deaths are higher in more Republican counties. Republicans are more likely to believe misinformation about vaccines. Republicans are substantially less likely to get it. Researchers have found that exposure to conservative media, particularly Fox News, made people more vaccine hesitant. This body of evidence had some limitations, though. For instance, the fact that red counties tended to have higher death rates than blue ones might not mean that conservatives were more likely to die from COVID if lots of Democrats who happen to live in the right-wing parts of the country were perishing too. Or Republicans were dying, it might also be because they were different from Democrats in ways that affect COVID outcomes, but were not directly driven by ideology. They might just be older and in worse health, or in a community with poorer health resources, for example. Now, I appreciate that caveat tremendously because it shows at least an attempt to be objective, and I appreciate that. They could have left that part out. Recently, however, a new working paper by 3 Yale public health economics researchers, Jacob Wallace, Paul Goldsmith-Pinkham, and Jason Schwartz, is offering the most definitive and direct evidence I've seen yet. Republicans have indeed been more likely to die because of COVID. The study, released by the National Bureau of Economic Research, also confirms the scale of and points to the central role vaccine hesitancy has likely played in the tragedy. Okay, much prior work on this topic relied either on surveys of beliefs or evidence about vaccination rates and deaths at the county level. The new paper, in contrast, uses information from voter registration files in Florida and Ohio to connect individual level data on the political affiliation and age of people who died during the coronavirus crisis. Using this information, it calculates and compares excess death rate of Republicans and Democrats in 2020 and 2021, meaning it looks at how many more people in each party died during the pandemic above what you would ordinarily expect based on the demographics and historical trends. Because they're using a measure that takes the age of population into account, the researchers' results shouldn't be affected by the fact that Republicans tend to be a little older than Democrats. So they're basically controlling for age. Technically, excess deaths measure how many additional people have passed away from all causes rather than just COVID, but public health experts like to use them to track the virus's toll because causes of death aren't reported uniformly everywhere, and it avoids whether coronavirus fatalities are under-recorded in some places but not others. In studies like this one, it also spares researchers the task of tracking down how each individual died, which isn't feasible. It's a standard and sound approach, unless you think something else besides the global pandemic has been causing a big spike in deaths over the past couple of years. So what did the authors discover? Overall, the excess death rate for Republicans was 5.4 percentage points, or 76% higher than the excess death for Democrats. The figure below illustrates the key finding of the paper. It shows a spike in excess deaths around the time of the pandemic, and then a growing difference between Republicans and Democrats in the rate of in the rate of excess deaths. All right, so this is actually from the paper. I'm going to show you this again in a second. But before I show you that and read the abstract from the paper, I actually want to go to the Washington Examiner because I want to give kind of whatever counter details that may be missing from this left-leaning source. Now, they tried to be somewhat unbiased, and I appreciate that, but were they successful in being unbiased entirely? Inquiring minds want to know. Okay, so Washington Examiner, where are you? Okay, here we go. All righty then. So here we are. Republicans had higher death rate than Democrats during pandemic, according to a study. This is by Ryan King.
Sparkling.
All right. Republicans from a significantly higher COVID-19 excess death rate during the pandemic than Democrats, according to a study. So that is something that they're in alignment with the Slate article on. For much of the days of the pandemic, voters from the two parties endured a somewhat comparable excess, with Republicans sustaining about 22% higher excess deaths. However, when the pandemic shifted into the vaccine phase, a much more drastic dichotomy between the two parties emerged. The Republicans sustaining 76% more excess deaths than Democrats, the study found. Overall, the excess death rate for Republicans was 5.4 percentage points, 6% higher than the excess death rate for Democrats. The study said the gap in excess death rates between Republicans and Democrats is concentrated in counties with low vaccination rates and only materializes after vaccines become widely available, end quote. So that's so far they seem to agree. The study was published by the National Bureau of Economic Research and circulated on Monday, but has not been peer reviewed. Okay, so now this right-leaning source, which I've anticipated, was more likely to point out things like this. That's not trivial. It doesn't mean the study's wrong, but whatever value that the peer review process contributes to studies needs to be taken into account. So it's not peer reviewed, and then I think that anybody could make this kind of criticism against any study that comes out that's making certain kinds of claims. It compared 2017 voter registration data in Ohio and Florida to mortality rates for those 25 who died from 2018 to 2021. It has a 95% confidence interval for most of its estimates. So I guess it's a 5% margin of error. I think that's the conclusion you can draw from there. The excess death rate gap between Republicans and Democrats jumped from 1.6 percentage points to 10.4 percentage points after vaccines became available, according to the study. This sharp contrast in excess death rate gap before and after vaccines were available suggests that vaccine take-up likely played an important role. The NBER study explained. Data on vaccine take-up by party is limited and unavailable in our data set, but there is evidence of differences in vaccination attitudes and reported uptake based on political party affiliation. Okay, so I guess pointing that out is meant to emphasize that there's no direct data on vaccine take-up, but it's kind of indirect data on vaccine take-up. To whatever extent that weakens any of the findings, I'll leave that to y'all to decide. The NBER study noted it was able to obtain voting data from Florida and Ohio, but it was not able to receive information on person's vaccination status. So there's at least some question about the accuracy there, because that would be something that can confirm it and debunk it either, not having that. Other studies and polling found that Democrats were more likely to receive a COVID-19 vaccine or undergo more stringent pandemic prevention measures than Democrats. For example, a recent Morning Consult poll found that only 64% of Republicans were vaccinated or plan to get vaccinated compared to 87% of Democrats. So that's some data. 69.3% of residents are fully vaccinated against COVID-19, while 59.6% of Ohioans are fully vaccinated against the virus. According to our World in Data, the national average of 68.4 fully vaccinated for COVID-19. The national average is 68.4% fully vaccinated for COVID-19. So Florida is above the average, but Ohio is below. Excess deaths in the NBR study were defined as, quote, the percent increase in death of expected deaths that are due to seasonality, geographic location, party affiliation, and age. End quote. The study relied on death rates in Ohio and Florida in 2018 and 2019 to determine the excess death rate during the first 2 years of the pandemic. Independent voters registered on the to other political parties were not evaluated in the NBER study. Now that's an interesting thing to point out because I think that would probably complicate the conclusions we could draw if we had tracked the independents and voters registered to other political parties. A total of 577,659 people who died in those two states were measured. So that's over 500,000. If these differences in vaccination by political party affiliation persist, then the higher excess death rate among Republicans is likely to continue through the subsequent stages of the COVID-19 pandemic, the study added. So this article doesn't really cast too much doubt. It pointed out some things that I think are intriguing, but it doesn't really cast too much doubt. And this is a right-leaning source. This is the Washington Examiner. Okay. Now, I want to read you the app real quick, and then I'm going to give some commentary, some carefully measured commentary. All right. So here is a copy of the study right here. Here's a copy of the study. All right, so the NBA working paper series, excess death rates for Republicans and Democrats during the COVID-19 pandemic. These are the three Yale professors that are authors of the paper. And I want to read this abstract. Political affiliation has emerged as a potential risk factor for COVID-19 amid evidence that Republican-leaning counties have had higher COVID-19 death rates than Democrat-leaning counties, and evidence of a link between political party affiliation and vaccination views. The study constructs an individual-level data set with political affiliation and excess death rates during the COVID-19 pandemic via a linkage of 2017 voter registration in Ohio and Florida to mortality data from 2018 to 2021. We estimate substantially higher excess death rates for registered Republicans when compared to registered Democrats, with almost all of the difference concentrated in the period after vaccines were widely available in our study states. Overall, the excess death rate for Republicans was 5.4 percentage points, or 76% higher than the excess death rate for Democrats. Post-vaccines, the excess death rate gap between Republicans and Democrats widened from 1.6, 22% of Democrat excess death rate, to 10.4, 153% of Democrat excess death rate. The gap in excess death rate between Republicans and Democrats is concentrated in counties with low vaccination rates and only materializes after vaccines become widely available. Okay, so what I'm understanding by this data is that early on in the pandemic, before we had vaccines, the death rates were more or less the same. Maybe Republicans had a little bit higher in these regions, particularly Ohio and Florida. And then after vaccination became available, that gap widened significantly. The gap in excess death rates. Now, the concept of excess death rates, as I understand it, is you have to have a baseline for what the normal amount of people dying in a given year is going to be, right? And then to whatever extent that there's more than what you would expect in a given year, that's going to be the excess death rates. So they calculated that for these Democrat counties in Ohio and Florida, and they calculated that for Republican counties in Ohio and Florida. And what they found is in the period after vaccinations were widespread, the amount of people who died, like on top of what you would expect, increased for Republicans at a higher rate than it increased for Democrats, and significant higher. So that's supposed to be the evidence that the kind of anti-vax attitudes that were a hallmark feature in Republican areas and amongst Republican voters. So part of the data that they have is who registered as a Republican versus who registered as a Democrat, contributed to the excess death rates. They contributed to trends by which more Republican registered voters died in excess in these areas. So that's what this is claiming. Pretty robust set of data. And it didn't even seem like the right-leaning publication refuted much of it at all. So here are the same figures that were shown in the slate thing. And you can kind of see the graph. So the red obviously represents Republicans. And then you see here, this is where the gap widens. And so this is Republicans relative to 2019, I believe, right? No, Ohio and Florida, Republicans plus Democrats. Okay. So this is both concentrated into one graph. Difference in Republican and Democrat excess death rate. So this is the difference being calculated here. excess deaths by registered party. So you can see, you can kind of track them in the same time period, and then there seems kind of huge explosion right here, and Republicans are kind of way higher by the time you get right before January 2022. So this is interesting data, and it seems to lend a pretty strong support to a contention that I think was fairly reasonable to begin with, which is that, yeah, the attitudes against the thing that's supposed to be, in some sense, causally efficacious in minimizing the likelihood of death and hospitalization. If you're anti that, and you have higher trends by which people are not getting vaccinated and therefore inoculated to the threat that's going to cause the death, then you're going to have higher deaths among them. So this forms, it seems, if this is correct, and this everything's on the up and up, and there's no substantive undermining critique to give of this study, then it seems that the Republicans are deserving of some fair and some harsh, although it should be constructive, but criticism. The policy positions that a lot of them took contributed to the deaths of people. People were misled by allegiances to the party line and certain political philosophies that resulted ultimately in more people dying than they needed to. We're talking about excess deaths. And I think that that's sad, that our political discourse and our ability to solve problems is so dysfunctional that you have people who are willing to cut their nose off despite their face just to oppose the other side that they don't like. And it costs lives. And what's worse, it's self-inflicted, because all of those people, presumably, who died, who didn't get vaccinated, who chose not to get vaccinated because they were led into thinking by whoever that there was something problematic about it when it wasn't, presumably their lives could have been spared and they'd still be here. And whatever loss that their family members had to endure because they're not here, they wouldn't have had to endure. And I think that that's sad, whether they're Republican or Democrat or not. Now, I would love to see equivalent data among independents and among people who are registered voters of other parties and see what those trends are. I don't know what potential that has for undermining, I think, the core contention of the study, but I think my anticipation, my hypothesis would be that it would complicate things a little bit, because I just think that this kind of thing is nuanced. I also would like to see data in other states other than just Ohio and Florida. By the way, I don't know that every red-leaning state has the same kinds of trends or the same kind of pronounced difference between Democrats and Republicans. I noticed New York wasn't on there, and motherfuckers was dropping like flies in New York. I would love to see data for New York. New York is blue as it fucking gets, and a lot of motherfuckers got murked in New York. I would love to see LA as well, because a lot of motherfuckers died in LA too, or California as a whole. I would love to see that data more thoroughly across the country, because I think this is going to be a complicated story to tell. I don't think isolating the data points in 2 states gives us a clear picture about what happened all over the country. I think it's way more complicated than that, for sure. For sure. And there doesn't really seem to be any rationale given why Ohio and Florida were singled out. The cherry picking nature of it, I think, raises some eyebrows, and I'm actually concerned, or not concerned. I'm actually surprised that the Washington Examiner didn't really raise that objection. I think that's a legitimate objection. I came up with that. I'm not even an expert, but that just from the baseline of just what my expectations are around objectivity. I don't know that I like that. So take it with a grain of salt. I don't know how definitive it is, but at least give some support to the idea. And if it is true, or mostly true, that a lot of places in the country, it is true to say of those places that Republican leaning, right leaning attitudes maximize deaths from COVID, particularly in the span of time after vaccines are widely available, Republicans deserve criticism for that. It's unacceptable. The ideological blindness of that is resulting in literal deaths. It is that kind of thing that I would be critical of if the left did it. So I have to be critical of it when the right does it. Any bad policy positions that are driven by ideological blindness that result in catastrophic effects, including but not limited to the deaths of citizens of this country, that's definitely criticizable. And to whatever extent right wingers contributed to that, shame on them. Shame on them. Your ideological blindness and your willingness to cut your nose off to spite your face resulted in the deaths of people. Shame on you. Shit is not a plaything. Motherfuckers died because they were misled by you. Because of certain propaganda that cast doubt that wasn't even based in anything other than a distrust of the deep state or some shit. Now, I get distrust of government. I get distrust of people in authority. We have that in spades on the left just as much as we have that in spades on the right. That I understand. But we have to keep enough sensibility or wits about us to recognize when it actually makes sense to express those doubts, serious and genuine though they may be. You don't want to gamble with people's lives. That ain't fucking cool. I'll close by saying this. I am not an expert when it comes to vaccines. I'm not really in a position, and very few people are, I think, to opine thoroughly or substantively on the failures and the successes of COVID policy in various different regions of the country. It stands to reason that more people died than had to, and that one of the biggest contributing factors to that were prevailing attitudes that were antithetical to maximizing the percentage of the population that was vaccinated. That there's a rational basis to criticize the quote unquote anti-vaxxers for that reason, insofar as they contributed to a cultural and social milieu or uh, various different attitudes whereby people were dissuaded from getting something that would have helped them. And to whatever extent right wingers or conservative types are contributing to people being misinformed with respect to decisions that they need to make and are negatively impacting public policy in a they always deserve criticism, period. And I wasn't really with the people who were gung-ho about taking ivermectin or hydroxychloroquine without the studies that verified that those things were actually going to be effective medications. Seemed like you'd be better off rolling your dice with the vaccines than with those things. But I don't know. And I'm not sure what the negative side effects of Paxlovid are and all that kind of stuff either. Again, I'm not an expert. I'm speaking on the edge of my understanding. This has been the Black News Podcast. I have another segment coming up in which I'm going to criticize the Republican types to whatever extent that they need to be criticized. This one was a little bit kind of half-assed because it's contingent on a conditional statement. I'm not sure that the study proves what it says it proves, but if it does, you're damn straight Republicans and conservative types need to get this smoke. You're damn sure they deserve criticism. Not out of spite, not out of hate, but constructive because they can do better. I'm your host, Jason Muse, aka the Black Muse. Till next time, peace.